psychiatrist. So we have seen that mental illness is having a lot of stigma in our country. So people do not come out in open and talk about mental health, or do not talk about if they are having any mental illness. So why is this like that? So first of all, we should know that like any physical illness, the illnesses which incur in the brain, uh, they are treatable. They can be treatable if a doctor or a psychiatrist see them in the first instance. So people shouldn't be late in showing their uh, illnesses or talking about their illnesses. Like I'm talking about mental illness here. People shouldn't be late in that case. People should talk openly, and in that way, the stigma can be lessened down. So, what are the few mental illnesses which we as doctors incur day to day? We see the major mental illnesses like schizophrenia, depressive disorders, bipolar disorders, OCD, and also drug abuse disorders, drug dependence disorders. We also see lots of suicide attempts cases in our day-to-day practice. The minor mental illnesses which we talk about, which we can see, are anxiety disorders, panic disorders, and few other illnesses like that. So if we talk about schizophrenia, so what is schizophrenia? In schizophrenia, patient will be having hallucinations, will be having delusions, will be having persecutory ideas, persecutory delusions, will be not having any relative contact. You can see a patient roaming about in the streets, not knowing what he or she is doing. So these are few things which a schizophrenia patient may have. So I cannot talk at length about the illness here. So if any one of you is seeing anyone having such problem, you should immediately contact a psychiatrist. So secondly, which we can talk about, is depressive disorders. So we all know that sometimes we feel depressed, but depressive disorder is a big and a major mental illness actually. So what is depression? Depression is a state of mind where the patient will be having anhedonia, will be having anergia, will be having hopelessness, helplessness. Patient may also have suicidal ideation, patient may have death wish. These are the things which a patient may have. Depression may occur in anyone actually. So depressive disorder also can occur in anyone. So if any one of you come across such problems, please contact your psychiatrist as soon as possible. So now there are other disorders which we can talk about, is anxiety disorders, panic disorders. So these things will be called disorders after fulfilling few criteria only. So these are few disorders which I had talked about. So knowing about the illnesses will let us discuss about these illnesses, will let us come out in open and talk about them freely. And with the help of your friends, family members, you can get rid of these illnesses very fast. So psychiatrists, with the help of psychologists and social workers, can treat patients into the state where they become disease free and can lead a normal life. Now once we talk about these diseases openly, once we talk about our mental health openly, then only the stigma in our country will lessen down. Thank you.